We have Dr. Sanjeev Jain here. He is allergy, food allergy, asthma allergy specialist, and we are very excited to have him on Sitare TV. Welcome to Sitare TV.
Thank you very much for giving me this opportunity. I'm having a wonderful time here. I've had an opportunity to meet wonderful other presenters, and I'm giving two talks here. My first talk is focused on understanding what allergy is all about, what food allergies represent, how they manifest themselves, and my second half of the talk will be focused more on how we desensitize people to whatever they're allergic to. What we've found is that there is no one in this world who cannot be desensitized. Even if somebody has a severe allergy to peanut, we can desensitize that person to peanut so they can actually introduce it in their diet, and they can be eating a whole peanut butter sandwich without a reaction. So that's been a very satisfying journey for me, where over the last 10 years, we have literally changed the lives of thousands of kids who initially would have a life-threatening reaction from a microscopic amount of peanut are now eating a whole peanut butter sandwich. But it's not just peanut. We're desensitizing people to any food that they're allergic to, whether it's dairy or if it's garbanzo beans or if it's cinnamon. We can desensitize people to whatever they're allergic to.
Sure. So all in all, the thing is that no matter what kind of allergies do you have, there are ways to desensitize them, and there are ways to work around that here. Now, my question is, do we always know, let's say, if we have some allergies to a food, is it possible that we have allergies and we have no clue that we are really allergies to those kind of foods?
Yes, we do see many people who have chronic symptoms. They may be chronic cough or chronic abdominal pain or nausea or skin rashes, and they don't realize that those symptoms can be related to their allergies. They can be from their environmental allergies, such as allergy to dust, allergy to animal dander or pollens, or it could be from food allergies. It could be allergy to wheat or allergy to soy. So that's why what we specialize in is first performing extensive testing to determine what they're allergic to, and once we identify what they're allergic to, then we can desensitize them to that allergen, and we can desensitize to environmental allergens as well as food allergens.
Now, what are the most common food allergies that we see, let's say, in Indian population?
Yes, so in Indian population, just like the general population, the most common allergens are peanut, tree nuts, shellfish, fish, soy, milk, egg, and wheat. And seeds are also a major allergens as well. In Indian population, we do see a fair amount of allergy to legumes such as lentils and garbanzo beans, and we also see a lot of allergy to Indian spices such as cumin seed and any other spice that we get exposed to.
But what if people just can't tell? I'm having very mild form of allergy, and they're eating, like, let's say, rotis, and then how do they identify that, oh, this is my symptom?
Yes, so that's why if people have any chronic symptoms at all, which could be related to allergies, such as rashes, we even see people who have just chronic fatigue or joint pain, and that's when we need to investigate by doing the allergy testing. And if they have allergies, then we can desensitize them. And we can also help them identify other conditions which may be related to their symptoms. For example, some people can have celiac disease, which is a different type of immune disease that can cause problems with wheat and other gluten-containing grains. So we can help them identify those types of conditions as well.
Would you like to tell about your clinics, all over USA that people can approach you?
Yes, we do have multiple clinics in the West Coast. In the San Francisco Bay Area, we have 4 clinics. Where we have one in Oakland, another one in Fremont, another one in Sunnyvale, and then we have one in Redwood City as well. We have clinics in Portland, Oregon area, as well as Seattle area.
Certainly. Anything else you would like to say to our viewers about allergies or asthmas, or when should they come to you?
Yes, I want to make a statement that my job is a very satisfying job because I see um, people's lives transformed. We've seen asthma patients who require hospital admissions on a monthly basis, and then once they come to get treatment from us, then what we find is they no longer need to go to the hospital. Their condition gets under much better control. The same thing applies for severe food allergies as well. People who have suffered from chronic symptoms such as chronic cough or chronic abdominal pain or chronic rashes, all those symptoms go away once their allergies get identified and they get treated appropriately. So we're very proud of what we're doing. We are one of the few clinics in the country which is doing desensitization to multiple foods, and I uh, believe in the philosophy that there is nobody in this world who cannot be desensitized to whatever they're allergic to, whether it's cat allergy or grass allergy or peanut allergy or milk allergy. There is treatment out there, so they need to seek that treatment for long-term relief of their symptoms.